All right, we're going to start our presentation on the effect of exercise on older adults with depression. First, I'm going to start with the background. Our group focused on depression in older adults, especially those in long-term care settings. Some causes for the increased rates of depression in this population are isolation, loss of independence, cognitive and physical changes and impairments, loss of friends and families. These can all have an impact on their quality of life, such as physical effects like headaches, backaches, joint and muscle pain, and these can result in less physical activity, less socialization, and poor diet habits, which can increase the risk for developing chronic diseases. There is a polypharmacy problem in this population due to treatment of multiple comorbidities that result in numerous medications. Some common adverse effects of medications are orthostatic hypotension, anticholinergic effects, extrapyramidal symptoms, increased risk of falls, which can lead to fractures, and osteoporosis. In addition, there are frequently many drug interactions that result from taking a combination of drugs for different illnesses that can have detrimental effects. Where is depression the worst? We decided to focus on older adults in long-term care settings. Some factors that can contribute to depression are isolation, change of environment, and daily activities. There is a significant need for non-pharmacological methods of treatment for depression in older adults due to poor adherence to medication, interactions, and many adverse effects. Contrastingly, exercise has few side effects, can be done at home or in a community setting, and is cost-effective.
Our PCOT question is, in elderly people within a long-term care facility, what is the effect of antidepressants on depression compared with exercise within 3 months? We chose the older adult population to focus on due to the huge concern of polypharmacy. According to our research, studies mention various benefits of exercise compared to antidepressants when treating depression. Therefore, we've decided to make exercise the I and the antidepressant the C of our PCOT question. For the outcome and timeline in our PCOT question, our goal is to determine if exercise is more effective when treating rather than antidepressants within a 3-month time span.
We decided to research this because depression is very common in the older adult population, but is often underdiagnosed. It is also not reported as often as it should be because people think it is a normal part of aging. If they are living in a long-term care facility, their chances of having depression goes up even higher. This is important for us to become more knowledgeable since we are becoming nurses and will experience this population often. By conducting this research, we are trying to find better ways to treat depression than the basic antidepressant therapy. We are researching whether exercise can be used as an effective form of treating depression in older adults.
Methods. In searching for literature surrounding our PCOT question, we had the following criteria. Since we were focusing on older adults, we wanted them to be over the age of 75. If younger adults younger than the age of 75 were included, results needed to be stratified by age so that we could elicit results for the older adult population alone. Participants either had to be in a long-term care facility or some sort of healthcare environment. Inpatient and outpatient participants were included. We included studies that were comparing exercise for standard treatment, which may be a combination of antidepressants and therapy, exercise versus no treatment, exercise versus psychological treatment, or a combination. Some exclusion criteria that we had was if the study focused on severe depression, if it only included younger adults, if it was a literature review, systematic review, or meta-analysis. Some keywords that we included while doing our search for literature included mild to moderate depression, older adults, and exercise. The database that we used was Google Scholar, and we included 5 articles in total. Reviewing our results from our literature research, we found that antidepressants are the most common treatment for depression in people of all ages. They are effective but can have serious adverse effects, especially in the older adult populations. While not all of the literature we reviewed agrees that exercise is more effective than antidepressants, there is a unanimous opinion that exercise is a great non-pharmacological option that has other long-term benefits as well.
When reviewing some of the literature, we found a few common themes throughout it. The first one was impact of exercise on depression. In a 12-year Korean longitudinal study showed a negative relationship between exercise and depressive symptoms in older adults in long-term care settings. The results showed a significant correlation between depression and those who exercised less than 3 hours per week, compared with those who exercised 5 or more. In terms of duration, those who had less than 1 year or 1 to 2 years of exercising had a higher score on the depression scale compared to those who had 5 years or more of exercise duration. This study implies that older adults living in community settings who are sedentary or do not exercise regularly have a higher chance of developing depressive symptoms. In a study by Halgren and others, the oldest age group, those between the ages of 50 and 71, saw significant improvements in depression. This indicates that exercise as a treatment for depression is still effective in older adults and that effectiveness does not depend on age.
The next theme that we found in reviewing our literature was exercise versus depression in treating, or exercise versus antidepressants in treating depression. Some studies found exercise to be effective in treating depression, but not as effective as other forms of treatment like antidepressants. In others, it was found to be more effective than antidepressants and cognitive behavioral therapy in reducing depressive symptoms. Antidepressants are useful in treating depression, but there is a serious risk of adverse effects, which we will discuss next.
The third thing we found were the serious adverse effects of antidepressants. In the study by Lopez, Torres, Hidalgo, and Sotos, antidepressant therapy showed to treat the symptoms of depression better than exercise therapy towards the end of their study. However, antidepressants have higher rates of adverse effects. This is a problem for the older adult population, considering they are already at risk for severe adverse effects due to changes in their metabolism and the risk for drug interactions due to polypharmacy. Their study found that exercise was effective in treating symptoms of depression, just not as effective as antidepressants. But with lowering the risk of potential life-threatening adverse effects, it may be better for older adults to use exercise as a primary form of treatment in depression.
Although medication is frequently the primary treatment, it isn't the only way to treat an illness. There have been several trials and studies that show how physical exercise can benefit the body and even be more effective than some medications. Physical activity may soothe the inconveniences related to chronic diseases, has positive effects on the quality of life and biological rhythms, and can prevent the decline in motor functions and the consequent falls, which are associated with elderly death and disability in the older adults. When a patient has a major illness affecting their life, they will be referred to occupational therapy and physical therapy to help them regain their independence. Not only is physical therapy great for rebuilding muscle and maintaining good health, it can also rebuild the brain's memory. Physical activity improves immune response in old age, impacting on metabolic disorders, including diabetes. It lowers cognitive and memory decline and acts in the early stages of depression and in dysfunctional attitudes, linked to non-acceptance of the limitation imposed by age. Older adults typically have multiple medications. Instead of adding more to their everyday schedule, physical activity is a better option to avoid polypharmacy. Nurses should advocate for their patients' health instead of just prescribing more medications to fix the problem. Taking the time and learning what is best for each patient is the best outcome. Physical activity can help maintain a healthy weight, reduce the risk of heart disease, help maintain blood sugar and insulin levels, improve mental health, and strengthen bones and muscles.
Some nursing implications to consider would be that older adults are at a higher risk for rates of depression, and using antidepressant medications can put them at risk for higher adverse effects. This poses a problem for nurses due to possible falls and other complications. We always want to lower these risks, not only for the patient, but for the nurses and hospitals as well. The adverse effects can range from nausea, dizziness, anorexia, and many other symptoms. These can put elderly patients at a higher risk for falls. With using exercise as a treatment for the patient's depression, there are fewer drug interaction symptoms for the nurses to be on the watch for. With less adverse effects or complications, it can lead to better outcomes for patients and have an overall better health.
For older adults who take 5 medications or more, their risk for development, disability, death, and falls is increased significantly. Nurses can encourage patients to see exercise as pleasure activity, which can propel patients into healthy habits to reduce their depression. Encouraging patients to get out and be active can help them not only physically, but mentally.
Thank you for listening.
Thank you for coming to our